Hi, this is Kathy Green, Marketing Manager with KidMed, and today we have Physician Assistant Taylor Monroe to talk about pink eye. Now, Taylor, I know that a lot of kids are going back to school face-to-face, and it seems that pink eye or eye infections seem to be a lot more common at this time of year. What exactly are they?
So pink eye, otherwise known as conjunctivitis, is basically inflammation of the conjunctiva. And what happens is the blood vessels in the conjunctiva, or basically the membrane that covers the white of the eye and the inner surfaces of the eyelids, the blood vessels become more inflamed. So it gives the eye like a red or pinkish color. And it's very contagious. That's why we typically see it when kids go back to school or in daycare settings.
Wonderful. Now, I know that when my children were younger, the kids were not allowed to come back to school if they had pink eye unless it had been treated or they had had drops for at least 24 hours. I also know that I've heard a lot of talk that it's a lot of times a virus or an allergy. So what would you recommend in the treatment of pink eye or conjunctivitis?
So actually, more times than not, it is viral. Usually when we are treating pink eye, for the most part, it's just because schools will not allow kids to go back without those antibiotic drops. So if you have the privilege to give it a few days and see if it gets better on its own, that would be ideal with just warm compresses and time, because again, usually it's viral and with time viruses get better. But if the discharge at any point gets worse, if it starts to become uncomfortable for the patient, we would want to see them and start drops immediately.
Great. Now, as a parent, especially I know with young children, what's the best treatment or what's the best preventative measures to avoid getting any type of eye infection or pink eye?
So when it comes to that, the most important thing is good hand hygiene. So hand washing before and after touching surfaces and before and after touching your face, especially your eyes, is very important. And then just...
That's okay. And it seems like hand washing is always the best measure of what people should be doing.
Exactly.
So once again, this is Kathy Green, Marketing Manager with KidMed. If you have anything you'd like to hear Taylor or one of our other providers talk about, please send me an email at info@kidmedva.com.